Today, we're going to explore the importance of templates and checklists when approaching long cases. Templates and checklists are invaluable study aids that not only ensure thoroughness, but also serve as effective memory aids. Although you won't be allowed to use these templates during the actual exam, integrating them into your study routine can reinforce your understanding of the essential components of a clinical clerkship. You can derive these templates from standard textbooks or use the ones provided in the MedScroll clinical exam course under the Templates tab. Let's start with the general template for clinical clerking. The first step is to address the main problem of presenting a complaint. When you meet a patient, it's important to ask, what do you consider to be your main medical problem? This question captures the patient's perspective, which is crucial for understanding their priorities. If the patient is admitted to the hospital, you should also capture the reason for admission, even if it isn't the same as their main problem. Next, we have the history of presenting complaint, or HPC. In this section, you explore and flesh out the main problem in detail. A good template will cover the key elements of the medical problem and can be applied to most conditions. It's also important to expand on any other active issues. Sometimes, the patient's medication list provides clues that help you further elaborate on their current condition. Following this, the review of systems, ROS, comes into play. Here, you document any additional symptoms that might not have been covered in the HPC. The goal is to ensure that all relevant symptoms and problems are addressed to provide a comprehensive view of the patient's health status. After the ROS, move on to the past medical history, PMH. This is where you list any previous or inactive medical problems that weren't discussed in the HPC, providing brief commentary as needed. Similarly, the past surgical history, PSH, should include any surgical interventions that haven't already been mentioned. The next section is current medications. In this part, you document a complete list of the patient's regular and as-needed medications, including over-the-counter drugs, supplements, and herbal remedies. It's important to note any issues with adherence. If the medication details related to the active problems have already been discussed in the HPC, you can focus here on medications for inactive problems. Following medications, you should briefly discuss the patient's immunization history, if relevant. This may not be applicable to every case, but it is important when immunization status plays a role in the patient's overall health. Next are allergies. Here, list any medication allergies, providing details about the reaction and, if possible, the date it occurred. If the patient has had subsequent exposures or has undergone desensitization, note these details as well. After addressing allergies, you move on to family history. Detail any family history that is pertinent to the patient's medical issues, noting any hereditary conditions or prevalent trends in health issues within the family. Social history is also a crucial component. Use a comprehensive template to capture all relevant aspects such as occupation, lifestyle, substance use, and living conditions. Because social history is weighed heavily in the overall assessment, ensure that this section is thorough and detailed. Don't forget travel history, especially if it is applicable to potential exposures to infectious diseases or other risk factors. In some cases, including sexual history is also important, particularly if it might influence the clinical picture. The next major section is the physical examination. Employ a focused approach, using a template that guides you through the exam based on the patient's presenting problems. A typical template might start with the general appearance and vital signs, then move into a system-based examination in order of priority. This template acts as your roadmap, ensuring that you don't miss any key elements during your exam. Once the patient assessment is complete, templates can also assist with your case write-up and presentation. Begin with an introduction for your presentation that comes before detailing the presenting complaint or main problem. Then, compile an assessment summary that highlights the key findings from the history and physical exam. Create a problem list that logically organizes the patient's active issues. This summary can serve as a springboard for discussion, as examiners might interrupt to ask for clarifications or direct further questioning. Finally, make notes on discussion points that include potential differential diagnoses, relevant investigations, and management strategies. Even though you won't recite every detail during the exam, having these points clear in your mind will help guide your conversation with the examiners. By incorporating these templates and checklists into your study and revision sessions, you can internalize the systematic approach required for a thorough long case assessment. They ensure that you cover every necessary element, from gathering a comprehensive history to performing a focused physical examination, and from integrating your findings into a coherent narrative to discussing your differential diagnoses and management plans. This methodical approach not only prepares you for the exam, but also builds a strong foundation for excellent clinical practice.